Hi, my name is Jasmine N, and the name of my project is Enhancing Nurse Scheduling Preferences for Job Satisfaction, the Nursing System Float Team Swap Shift Project. And this is for my research and professional practice courses at CDU University. So here we have the table of contents, and this is a list of topics that I will be covering as I continue on in my presentation. So my clinical site is UCLA Health Ronald Reagan. The name of my preceptor was Gilbert Barco. He is the assistant director for the NSFT, which is the Nursing System Float Team, and his role is that he manages the float pool RNs for the ICU, emergency department, PACU, and the OR. His clinical background is in critical care. So now I'm going to be discussing the significance of the problem and why the problem represents an opportunity for change. Nurse retention is critical for the healthcare industry, and healthcare systems that can recognize and comprehend the factors that motivate and incentivize nurses from a staffing perspective are more likely to experience improved nurse retention rates. Other research has shown unsatisfactory scheduling is a significant cause of nurse resignations, with 30.4% of nurses citing it as a primary reason for leaving their positions. This evidence-based project aims to enhance scheduling flexibility by implementing a swap shift change project. The goal is to enable the nursing system float team within a Los Angeles hospital system to exchange work shifts in order to improve their schedule preferences. Currently, the swap shift proposal feature is unavailable on the ANSOS web scheduler software, but it will be activated, which will allow nurses to electronically swap their schedules with each other, resulting in improved scheduling for the team. So you may ask, why the need for this plan change? So the current problems are that the option to swap shifts does not exist for the nursing system float team in any sort of form, electronically or non-electronically. And this is an opportunity to expand the features of an interactive scheduling system that will establish guidelines for future staff-oriented scheduling systems. So another problem is that the swap proposal feature within the ANSOS web scheduler is not active for user functionality. And what we're trying to do is optimize the current build within the ANSOS web scheduler to offer self-directed shift swaps proposals among the nursing staff within this department. Another problem is that unsatisfactory scheduling for nursing system float team nurses can lead to job dissatisfaction and poor attendance. So by not being able to swap a shift, they will just more likely call in sick. So what we're trying to do here is improve scheduling flexibility and job satisfaction for the nursing system float team while also meeting hospital staffing needs. There are projected barriers and constraints that we are considering for this project, and those barriers are operational side limitations due to increasing workload for the staffing office, because there can be potential for unmanageable volume of requests. Along with that, the volume of swap proposals can potentially be high, and there's a concern with an increased workload for staffers. So we are trying to streamline the process. Third, we need to figure out how to activate the functionality of the swap feature in the software and the associated processes and how and what this will look like. And then fourth, there is a high concern for missed notifications when a swap is approved, and this will result in no-shows or poor attendance with the staff. The change theory that I have applied to my evidence-based project will be an application of the nursing process theory by Ida Jean Orlando, which she constructed in 1958. She initiated the nursing process theory, which continues to direct contemporary nursing practice today. And this systematic method employs key elements of critical thinking, patient-centered strategies, and evidence-based practice suggestions in order to deliver holistic and scientific care. And we are able to construct high quality patient care as well as system processes with this theory. This process and theory operates as a structured roadmap for this EBP change project, and there are 5 compromising stages to this theory, which are assessment, diagnosis, planning, implementation, and evaluation. So as you all know, assessment involves the critical thinking and data collection. The diagnosis is the clinical judgment and the formulation of a diagnosis. And then we have the planning phase with goals that are specific, measurable, attainable, realistic, and timely. And then the implementation, which is the action or doing, followed by the evaluation stage, which would reassess the outcomes, and the plan of action can be adapted based on this new assessment data. So my EBP project question: for the nursing system float team within a magnet designated hospital system located in Los Angeles, how does implementing a swap shift change project with RN to RN self-scheduling electronic shift swaps in the web scheduler compare to the absence of such a project, affect job satisfaction, reduce sick calls, nurse retention rates, and turnover rates within a 6-month period? So the plan of action with the approaches and alternatives, for number 1, we will have shift swapping. This is the project that I'm implementing, and this will allow nurses to swap shifts with each other, and they will input their preferences, which will generate schedules based on these inputs. Secondly, which would be ranked less than this, there would be shift bidding, where a system would allow bidding on preferred shifts based on seniority and other criteria. And then finally, rotation pools, where nurses are able to alternate shifts or units, which would promote variety and reduce monotony in shifts. So in my notes, I have the pros and cons of these different alternatives. Review of the literature. So research by Wright et al. Shows that schedule flexibility implemented with electronic self-scheduling systems improves nurse job satisfaction and retention. Other studies have demonstrated that scheduling positively impacts nurse satisfaction, and implementing flexible work arrangements is crucial in enhancing job satisfaction and retaining nurse staff. And I use PubMed, ProQuest, Google Scholar, and a various other search engines. These were screened for full text peer-reviewed articles to review the literature on the topic, and I have the key search terms and phrases defined below. As far as the summary of the evidence, a lot of the evidence is conclusive and says that self-scheduling not only enhances nurse satisfaction, but it also leads to reduced turnover costs, and nurses perceive increased professional development opportunities and autonomy when they transition to this type of scheduling. Other research has shown that self-scheduling can positively affect job satisfaction, and this can benefit both the workforce and the individual nurse, which can also help meet staffing needs when all parties are happy. Koning 2014 reports that flexible work schedules grant the nurses autonomy to balance work and personal life while assisting organizations in meeting their staffing requirements, which also enhances job satisfaction. And another theoretical framework highlights the association between mental strain and a combination of high job demands and the lack of control over one's job. So nurses and nurse leaders can promote an environment encouraging participatory stress prevention by granting nurses more control over their work schedules, and by allowing self-scheduling and shift swaps, this is a reasonable solution for that. So based on the evidence, the recommended best practice is that leadership and management endorse change and enhance performance by ensuring the healthcare system remains adaptable by collaborating with staff nurse requests for scheduling flexibility. So my policy will be to enhance scheduling flexibility through a swap shift change project. This project will enable RN to RN self-scheduling, electronic shift swaps in the web scheduler software, and the goal is to allow the nursing system float team nurses to exchange shifts, which will improve their scheduling preferences. And again, the aim is to enhance job satisfaction, improve attendance, and increase staff retention. So when nurses can align their work hours with personal preferences, they are more likely to feel valued and motivated in their roles. For my protocol, this will follow the official project charter, where I had the honor of being the build lead as the MSN student. I worked with a group of ICU RN nurses and then my nursing manager, Gilbert, and I templated this project charter, which had various subheadings, our project goals, our problems, opportunities, the scope, in scope, out of scope, the assumption criteria. I did a review of the literature. We had various weekly meetings, which are all listed here, with notes that I took as we continued to develop this project. So following the protocol, we have the tip sheets that I templated for this project that will be sent out in emails to the first group that will be demoing our project. And here we have 4 different documents. The first one is how to swap, which lists the guidelines and the protocol for the nurses on what is allowed and how this process will work. I then have screenshots that will walk the nurses through how to submit a swap proposal, how to retract a swap proposal, and how they can respond to a swap proposal. So my implementation plan involves this project timeline that you see here, and I worked with my teammates on weekly meetings, and you can see the projected timeline of how we developed this project. And the final build actually was just completed this week. We are sending out the tip sheets, and we are going to go live on August 20th, 2023. The implementation plan also follows a separate schedule, and the sustainability plan, we will have ongoing audits, and then eventually, hopefully, we'll expand to the entire nursing system float team. So for the evaluation plan would involve long and short-term goals, and to ensure the project's sustainability, real-time usability, and success, audits would involve email surveys or general feedback from the staff for quality control. Leadership and management will run informatics on pre and post intervention for staff retention and attendance reports. Scope changes and significant issues would be identified for continuous fine-tuning and improvement to this project. And after the pilot testing launch date, the project will expand to the entire nursing system float team. A project closure report meeting will analyze if the project was successful and if the goals were met. So here is the template for the project closure report, and you can see what will be discussed in that meeting. And our go live date is August 20th, 2023. This project does exceed beyond my clinical rotation, but I am going to continue working on this project remotely with my nurse manager to see it to its end. And I'm very excited for the project launch. So I have no results as of now. These are some of the resources that I used for my research. And thank you for listening. This concludes my presentation. Thank you for a wonderful semester, and I hope this was informative and entertaining. Have a lovely summer. Thank you.